One of the most common questions that I get asked so frequently nowadays is, Dean, I've got tightness in my right hip. What's the best exercise to do for that? Or, Dean, it's my back now. It's tight and stiff and sore. What's the best exercises? What's the best exercise or exercises to do for that? Dean, my leg is cramping more than normal. What's the best exercise to do for that? And my answer is always the same. And it is, I can't tell you just off the top of my head. I can guess at a couple things you can try, but it may not be exactly what you need. So I named this the top 10 sciatica relief exercises because I wanted to get people's attention and draw attention to let them know that there's nobody out there who can give you the best exercises for you specifically for what you're dealing with sciatica. And there's reasons for it. I'm going to go over 5 different reasons why there are no specific exercises that I should be giving out to everybody so that they can overcome their sciatica, because number one, it wouldn't be right. So, number one, why is it that there should not be anybody saying, here are the best exercises for you to do for your sciatica? The number one reason is there's no 2 people out there who are identical in the way that they're dealing with their sciatica, or 2 identical people with identical symptoms from an identical cause of their sciatica. And no 2 people respond to exercises the same way. No 2 people have the same underlying issue. No 2 people's bodies compensate the same way for the pain that they're having. And for me to guess what exercise you should be doing for no matter what your symptom of sciatica is, it would be that, merely a guess. And I would rather err on the side of being conservative, not getting you upset with me for me guessing wrong, but me letting you know the truth. Okay? Many people come in and work with me who have an L5-S1 problem or an L4-L5 problem, the 2 most common spinal level problems for those who are dealing with sciatica. I have yet to meet 2 people who do the identical exercises and get the same results. Okay? Yes, I'm sure you've all seen the cookbook approach to sciatica relief. If someone's got pain in the leg, what do? Get on your elbows on your stomach and then work your way up as high as you can and try to do that repeatedly. Does it work for a lot of people? Absolutely, it does. I used to get 15 to 20% of my clients who had sciatica doing amazingly well by going through the cookbook approach. Same thing for everybody. The generic handouts, you've seen them. You've seen these exercises, I'm sure. Many of you are familiar with them. Many of you have probably tried them and have probably sworn at them. Some of you maybe even swear by them. And that is awesome. I'm glad you're getting relief. Okay, number 2, each person will typically have a movement bias, whether that be for flexion bending forward or extension bending back. Some people may actually have a bias for side motions, one way versus the other. And for me to give you exercises and say, hey, slap down a pre-cut cookbook approach sheet of exercises for you, half the exercises may be awesome. One exercise may be awesome. Some of them will probably aggravate things, and I don't want to do that. So you need to get assessed by somebody who knows what they're doing. Number 3, how did you injure yourself? When you basically just ask somebody, hey, what are the best exercises for sciatica? We're shooting blindly because we don't know how you injured yourself. Or did you just wake up with pain like this? Did you just bend over and lift up a pencil? Or did you try to lift something 50 or 60 pounds that strained your back? Did you just pull a muscle? Or do you have a disc problem? Or is it a joint problem? Did it just come on for one day without any reason or cause? If somebody doesn't understand what your symptoms are and what your movement biases are and what's going on with you and how your body's compensating, it's nearly impossible to just say, hey, it's easy to say, hey, try these. And we cross our fingers and hope that something comes out right. 3rd reason why there's no 10 best exercises for sciatica, because basically we are guessing and just playing the odds that certain exercises or positions will help, and they may very well help. But would you rather work with somebody who assesses your different movement biases, or better yet, teaches you how to assess yourself so you know which exercises you should be doing and what you shouldn't be doing? Or would you rather just go with somebody or the internet and get the cookbook approach and the generic general approach to therapy? And I'm telling you, before I learned the techniques that I do now, and I've been a physical therapist for 30 years, I was getting 15 to 20% of my clients better without doing anything but handing them a sheet of paper. And they thought I was amazing. 80 to 85% of my clients thought I was just worthless. And it wasn't because I wasn't trying, it was because I was doing everything I knew and would hand out those generic exercises, the press-ups, the knee to chest pulls, the knee rocks side to side, the hamstring stretch, sitting on a tennis ball, doing nerve flossing, all the generic, what I call generic exercises that most people give for sciatica or the big core strengthening. You got to tighten your stomach, you got to work on your pelvic tilt, you got to do the bridges, you got to do the dead bug activities. All great exercises when done to the right person in the right way because they were assessed to see that that is what they needed. Last but not least, number 5, why there are no 10 best exercises for sciatica pain patients and why you shouldn't just accept generic exercises. I would not personally want to risk not getting you better, but I also wouldn't want to risk making you worse by having you do something without either having you assess yourself to see if it's going to be beneficial, or having me assess you, or having you been assessed by a therapist who understands what's going on. So that general cookbook approach is not the wisest. And I'm telling you, nearly every day, someone in my Facebook group or someone will message me or I'll get an email, Dean, this is my pain. What exercise would you suggest I do? And my answer is always the same. Well, first you've got to assess what movements are easy for you and what movements are hard for you, and avoid doing those movements that are hard for you. Okay? They're just frustrated. And I get so many people who come into my group or so many people who write me and say, Dean, I've tried everything and nothing has worked. It's sort of like just trying to throw things against the wall and see, hey, what's going to stick? What's going to work? It's sort of a haphazard way about going about doing things. If you're trying chiropractic, massage, physical therapy, and acupuncture all at once, do you know which of those are aggravating you and which of those are helping you? Because it's going to be very hard to get consistent relief if you keep on doing things that are triggering your problem. Okay? And just like in certain recipes, there's certain ways you should do things and a certain order of the way you should do things so that that recipe will come out right. I don't know how many of you bake or cook, but if you add too much salt, what does that do to a meal? If you add too much sugar, what does that do to something sweet? If you don't sift your flour, what can that do to a cake or some cookies? It can leave it clumpy. If you forget to grease the pan, that's what I do a lot. Everything will stick and it'll be nasty. I asked my wife before, because I'm not a chef or a cook, and I just said, can you tell me a recipe that has to be done in a certain way or it won't turn out correctly? And she said, probably sourdough bread, because it has to rise before you beat it down, before you put the extra ingredients and the flour in it. So imagine if you took all the ingredients of a cake and just threw them together without measuring them, without putting them in the right order. The cake would not come out the way it's supposed to. In the same way, when you have sciatica and you haven't been assessed correctly, or you haven't assessed yourself correctly, and you haven't tested the exercises to know what's going to be helpful and what's going to be harmful, if you try to do everything all at once, it's like trying to bake a cake with all the ingredients stacked in front of you, not knowing how much of each, when to put things in. It will be a mess. So, are things helpless? Absolutely not. What should you do? My big suggestion to you is I would find a physical therapist who understands body balancing, who knows how to assess what's going on in your body, because here's what happens. Anytime you have pain, stiffness, tightness, soreness, discomfort, or anything out of the ordinary going on, and with sciatica, you have something out of the ordinary going on, whether it's a disc whether it's stenosis, whether it's a ligament, whether it's some inflammation just generally in the back, even if it's a cyst, if it's your SI joint, if it's your piriformis, another gluteal muscle, or your hamstring muscle that's causing that sciatica to be aggravated, your body is naturally going to want to protect itself. And when it does that, it's going to compensate, meaning the area that is problematic is going to tighten down. So those muscles are going to be out of commission for what they normally do and what their normal function is. And what that's going to cause is it's going to cause the rest of your body to have to make up for what those muscles aren't doing. And it's going to throw your body out of balance, right side versus left side, front versus back, and your body's going to be strained. So you need to find a physical therapist who understands this and who knows how to balance out those imbalances, because if this is pulling here to compensate and this is pulling here to compensate, that's adding stress to your body that takes away from, number one, your body being able to focus on healing, but number two, that stress is also adding stress to the area of your problem, so it will not heal optimally. I hope that makes sense. Number two, you need to find somebody who can walk you through and who can teach you about what the triggers to your pain are. And by triggers, I mean those things that amplify your pain, those activities, those movements, those positions. Real simply, if you had a scab on your arm that was trying to heal and you kept doing this to it, and you would look down every 10 minutes and realize after you scratched it that it was ripped up, it was bleeding again, and it's starting the whole process of healing all over again, do you know the triggers to your sciatica that are causing the irritation to continue? Because if you don't knock out the triggers, you can be putting all the ingredients in right. You can be doing all the right exercise. You can be eating all the right anti-inflammatory foods, taking the right drugs. But if you keep doing this to your sciatic nerve in the area where the problem is, guess what's going to happen? You are not going to heal. So triggering the symptoms, whether it's through a position, through a movement, through an activity, you need to figure out what those things are. And if you don't, it's going to take much longer, and it's going to be a much slower healing, and it's going to be much more painful. Okay? In the same way, if you had all the ingredients right of your cake, but you didn't know the measurements and you didn't know how to put them together, the cake's not going to turn out unless you're very, very lucky. So hopefully this helps you understand why doing the exercises on YouTube or Google that you found in a generic search did not give you the results that you want for most people. I have heard some people say, hey, I went to Google, I found such and such therapist, I found such and such chiropractor, I found such and such trainer. The exercises were great for me, and that's awesome. And I'm so happy for them, and I'm glad it worked. But you wouldn't be watching this video right now if that was the case for you. And I can tell you that 80 to 85% of the people, it is not the case that just handing a cookbook group of exercises and generic exercises are going to help you. So there is a way to overcome this. Find the right therapist. If you are looking for help, this is what I do. This is my specialty. I've been focusing on sciatica over the years, and my success rate went from the 15 to 20% success rate with my cookbook approach to well over 95% since I've been online now over the past 4 years. Please reach out. You can leave a comment below and I will try to answer you. You can always reach out to me at info@sciaticareliefnow.net. I have programs that I offer. I can do an initial video consultation with you. The current price is $50 for that. And I can get you set on a road and set a plan of action out for you so that you can get the relief you deserve. Because my big goal is I want to help 100,000 people get free of sciatica, start living their lives, start getting back with their family, start getting back with their friends, take a walk with their family, take a walk with their dog, go on vacation, and stop thinking about sciatica and how it's ruined their life. And I want that for you. I've helped hundreds of people online already, thousands of people through my clinics previously before I sold them. And my heart and my passion, and what my wife calls my obsession, is helping people overcome sciatica and start living again without medications, injections, or surgery. Please If you like this video, please give it a thumbs up. Please subscribe because I try to get new content out there as often as possible, and I try to get it out on a weekly basis. And if you have any questions, please feel free to reach out. You can look down in the section below this video and find out information about me. Jump on my website and let's get you the relief that you finally deserve. Because if you've been dealing with this for longer than 2 or 3 months, like most of my clients, it is time to get you the right treatment, the right approach, and the right way of doing things. I hope you guys have a wonderful day.